طلابنا الأعزاء السلام عليكم. محاضرتنا الثالثة بمادة الكراون and the bridge will include the evaluation of abutment teeth for fixed partial dentures. First of all, let's start with a definition for the abutment tooth. The abutment is a tooth or portion of a tooth that supports or retains a fixed bridge or part of the bridge, to which usually the retainer or retainers are connected or cemented. The abutments may be in the form of tilted abutment teeth, cantilever abutment teeth that carrying a pontic at one side only. It might be pair abutment or even in the form of post and core. Usually all forces, whether they are directed in a horizontal way or axially, are absorbed by the missing tooth, are transmitted usually through the pontic and connectors and retainers to the nearby abutment teeth. Therefore, the choice of the abutment is very important because it has to withstand the forces that are acting on those abutments and on the pontic as well. And also increasing the number of pontics also have much more double stress on the nearby abutment. So the clinician have to evaluate the abutment teeth carefully using certain evaluation aids, which include firstly the clinical examination tools like mirror, probe, tweezer. We need also vitality tests, radiographs to see the level of the bone support, the root configuration, endodontically treated teeth, and etc. We need also the diagnostic cast to see the correlation between teeth, and adding to them, we need also the periodontal probe. The requirements for the abutment teeth to be ideally for a fixed bridge, abutment for a fixed bridge to be vital tooth firstly, whenever it is vital, it will be the best, receiving an ideal tooth preparation and can carry or support the fixed bridge. If they are endodontically treated or if they are non-vital generally, they must be endodontically treated teeth. At that stage, we can check if they are asymptomatic, and the radiographical evidence show good seal of the root canal, complete obturation to be used as abutment, usual abutment, or in the form of post-core to increase the retention and strength of the prosthesis. Also, the supporting tissue that surrounding the abutment teeth, they must be healthy and free from any inflammation, with no mobility. In case of severe periodontal disease, we cannot include these abutment teeth for a fixed bridge, or generally they are contraindicated for fixed partial dentures. This picture shows two form of comparison between the healthy and unhealthy tooth condition. In the healthy section, we can see the normal form and color of the gum, firm and pink and healthy, healthy attached gingiva, and also healthy bone and good bone level. While on the other side of the picture, we can see the periodontally involved tooth that's showing the presence of plaque and calculus at the surface of the tooth, the loss of the gingival attachment, the inflammation of the gingival tissue, adding to that bone loss. The criteria of evaluation usually divided into three sections. Some of the evaluation related to the tooth, and which include the tooth form, which include shape, size, length, and also the tooth condition. It means the presence of the caries and the pulp condition, and also adding to that the location of the abutment tooth. The other evaluation, it must be concerned with the root, which include the crown root ratio and root configuration. While the last section is the gingival periodontal complex, which include the condition and state of the gingiva and the periodontium. Let's start with the factors that are related to the tooth. Firstly, the shape of the tooth. Sometimes you can see some variations from normal for the shape of the crown. Some crowns shows conical form, peg shape like in lateral incisor, and other maybe bulbous or tapered. All these conditions will interfere with the preparation parallelism. And it also necessitates full coverage to improve aesthetic and retention. طبعا المشكلة اللي راح تواجهنا في حالة الشورت clinical crown اللي هو يكون poor retentive وأيضا short proximal crown, and we cannot usually perform the usual crown preparation in some conditions. We need to do intentional endodontic and do post and core to improve the crown length. So it might be carefully evaluated and to see what's the best thing that we can need it for to achieve parallelism or achieve good retention and aesthetic as well. Many examples we can see clinically as pec laterals, anterior teeth with poorly developed cingula and short proximal walls, as you can see here. It's very short proximal walls. Sometimes mandibular premolars with poorly developed lingual cusps and short proximal surfaces, and also adding to that the thin incisors, which usually can be seen in the lower incisors. Secondly, the crown length and size. The ideal abutment, it must have adequate occlusal cervical crown length to achieve sufficient retention. Sometimes we can see very long crowns or sometimes short crowns. In case of short crowns, we need to usually prefer the full coverage restorations, and sometimes we need a crown lengthening in order to achieve adequate retention. بالنسبة للجنجيفكتومي راح نتكلم عنها بالsoft tissue management. فإذا كانت localized we can do it or less than 2 mm. We can expose the clinical crown by using the high-speed handpiece. Sometimes no, if it is multiple teeth, and if it is more than 2 mm, we can send and refer the patient to the periodontal surgery to do a gingivectomy and do exposure of the clinical crown. Whenever we have an adequate length, we can have a sufficient retention. And also for the crown size, there are different crown size that necessitate a full coverage and they are poorly indicated to be restored with a partial veneer crowns. The health of the abutment teeth, the presence of the caries, the extension of caries lesions, and the pulpal involvement. In case of sound abutment, we have no problems. It will permit an ideal type of a preparation. In case of carious teeth, we usually, if it is a moderate carious lesion, we can perform removing the carious lesion, doing cavity preparation, full pulp protection by lining, and then restore to its original form with a suitable filling material. Sometimes it's very shallow, even do not necessitate any operative intervention. Just do the preparation, and when you have a small spot of caries, you can remove it and add any suitable material. In case that we have a more fracture of the crown or extensively, depends on the treatment, will depend on the degree of the mutilation of the crown, and this also depends on the size, the number and location of the carious lesion or restorations in a tooth. This will influence the type of retainer on the abutment. Okay, in most cases إذا كان الكاريوس small أو كان far away from the margins, بهالحالة the retainer design usually we have no problems, it will extend beyond the carious area. إذن دائما إحنا لازم يكون عندي free margin, sound margins, free from caries or even restoration. مثل ما نعرف إنه ال end of our preparation لازم تكون on sound to structure. فإذا كان الكاريز small وaway we can either restore it before doing preparation or after doing preparation. لكن في حالة severe mutilation or fracture فبالحالة removal of the tooth might be indicated. How to know that this tooth will be restorable or not? Take in your consideration that this slide will not present in your PDF, so I will explain it here in this video. Usually to know that if this tooth will be restorable or not, there are certain measurements. Some of the measurements, vertical measurement to see how the length of the remaining wall measured from the gingival margin, and others related to the thickness of the remaining wall. الأدوات اللي نستخدمها عادة هي periodontal probe في حالة measurement of the length with a stopper and ruler. For the thickness of the wall we usually use the caliper. الميجرمنت تكون on the four walls, okay, buccally, lingually, mesially and distally. أحيانا يكون عندي enough wall thickness and wall on buccal, lingual, mesial, لكن distally we have a big disruption. Also this tooth will be considered to be sometimes not indicated, not restorable. Usually the accepted height اللي نعتمده هو اللي هو يكون more than 2 mm from the gingival margin, while the accepted width it must be more than 2.2 mm. إذا كان the wall extended from the away from the gingival margin نعتبره بالحالة positive. إذا كان below the gingival margin or even with بالحالة راح يكون negative with moderate to poor prognosis. أما بالنسبة للmeasurement of the wall هنا الصورة تشوفنا بأنه 1.4 mm, it means that less than 2.2 mm فبالحالة عندي moderate prognosis. تخلي بالك إنه بعد restoration with the crown preparation هذا المتبقي من الوول كله it can be removed. فبالحالة لازم من البداية يكون careful evaluation for the abutment if it is restorable or not restorable. أحيانا يحتاج gingivectomy. Okay, أحيانا نحتاج intentional post and core. If it is not restorable نخلي بالنا إنه this abutment tooth must be excluded from the crown and bridge design. The vital teeth usually are preferred. However, pulpless teeth can be used only after endodontic treatment. أما حالة transition cases من يكون عندي pulp capping, it must be avoided. Because they are under the risk of requiring root canal treatment. هنا إذا كان التوث يكون recently you do proper direct or indirect pulp capping, it is very important to give more time for pulp healing and with follow-up for the patient. After a certain time when you have no sign and symptoms, you can complete the restoration and re-evaluate this tooth after healing, and then you can after that to be included in the fixed partial denture. In case that we have a grossly destructed teeth, here we can use other means like pin or dowel and core if they are endodontically treated restorations to restore the crown morphology, and we can later on do the preparation, and we can in these conditions we can include such abutment in the design of the fixed partial denture. The fifth factor that related to the tooth is the axial relationship. Usually there are different forms of malposition of the teeth, either due to rotation, tilting, tipping, or overlapping. All these conditions must be evaluated carefully because it will affect the decision to include or exclude such a tooth to be used as abutment. There are different tooth movement. قسم منها تكون in the form of tipping. Tipping ممكن يكون crown tipping or root tipping. Okay, in tipping we can see that the crown and the root moving together in one direction, either mesially or distally, buccally and lingually, لكن they are moved together. إذا كان center of rotation near the apex سميناه بالcontrol tipping. إذا كان near the center of the tooth or center of resistance راح نسميه بالuncontrolled tipping. في حالة التوركينج يكون movement of the crown in one direction while the movement of the root in the other direction. وأيضا عندنا other form of malposition اللي هو rotation extrusion or intrusion. طبعا ليش يأثر على decision to be included or excluded؟ لأنه ممكن بالتورك أو rotation يصير عندي damage للسupporting structure، وهذا يسوي لي lead to the retainer to be loose. وفي نفس الحالة إنه إحنا مثل ما نعرف إنه إحنا عندنا extra pressure on the abutment tooth، فإنه ممكن إذا سوينا bridge after less than 6 months ممكن يكون increase the mobility or increase because as we say that there is a damage in the supporting structure and we can at that time lose both the tooth, the abutment and the bridge as well. هذا يحدد لي malposition، يحدد لي استخدام ال specific retainer. نخلي بالنا بأنه ال over reduction usually حتى نحصل على الباراليزم ممكن يؤدي إلى weakening بالtooth structure and endanger the pulp health. لكن مثل ما قلنا إحنا قبل ما نقرر بأنه هو indicated or not indicated لازم يكون ال amount of tooth movement إذا كان be corrected by the orthodontic treatment، إذا كانت not corrected، إذا كان عندي loss of bony support ما نقدر بهالحالة to be included in the bridge، وإذا كان عندي acceptable ممكن إنه باستخدام ال minor retainers or minor coverage نقدر نستخدمه بالcrown and bridge design. و other factor إنه rotation of the tooth يأثر على ال size أو space available of the pontic، أما يقلله أو يزيده، فبالحالة يأثر على ال design of the pontic. هنا هذه نقطة ال pontic design بيها a lot of theories a lot of designs اللي هي ما مشمولة ضمن البروجرام مالتكم، لكن احنا المهم نعرف انه ممكن يأثر على ال pontic selection. نشوف هنا واحدة من ال clinical condition بيها elderly patient with a history of successfully treated periodontal disease and dissatisfaction with the removable appliance. Patient ما يريد removable appliance، يريد fixed. فبالحالة الفيكست أولاً نفكر بالديزاين إنه يكون minimal coverage مثل ما بنستخدم هنا الدنتست نستخدم ال resin bonded bridges cantilever resin bonded bridges. فأدى بأنه أولاً سوى minimal preparation by using those retainers فإنه protect the teeth from further damage. نشوف هنا lingual inclination of the teeth. The second positive things إنه سوى replacement للmissing area، عوضها بأسنان تشبه الأسنان اللي هي المissed area the same configuration. وثالثا سوى splinting لباقي الأسنان. فإذا إحنا من نستخدم هذه الريتينرز ومثل ما قلنا يعتمد على ال amount of malposition، يعني قسم منها تكون restorable وقسم منها تكون very inclined and cannot be included or cannot be indicated for fixed bridges. The factors, other factors that are related to the root تشمل ما يلي root configuration. root configuration يشمل ب root shape and root angulation وأيضا the length. Usually the shape of the roots determine the ability of the roots to handle the occlusal forces. فكل ما كانت عندي roots a higher bacolingual dimension than medial distal dimension راح تعطيني better support than a tooth with similar root surface area ولكن circular cross section. يعني usually those teeth with higher bacolingual dimension يكون شكلهم elliptical in cross section، فيعطيني better support better stability مثل ما نشوف هنا بالcanine if we compare it with the central incisor. فإذا نقول بأنه elliptical form is better, give more support for the bridge than circular cross section. Other factor هو shape of the root. إذا كانت الroots furrow-sided with a developmental depression it will be better, give more support and can resist the occlusal forces in comparison to the smooth sided conical roots. اللي نشوفه هنا بالcentral incisor. مو معناه إنه إحنا من يكون عندي conical shape root we cannot use it as an abutment، لكن في هذه الحالة it is indicated for short span bridges when other factors are optimal. Okay. The other factor هو length of the root. The longer the root راح يكون عندي the stronger, since the root length is directly proportional to the stability and strength of the prosthesis. فإذا نرجع ونقول بأنه as a summary إذا كان عندي greater bacolingual dimension than mediodistal يكون better support, better stability إذا كان عندي longer root، وإذا كان عندي أيضا multi rooted teeth. فبالمالتي rooted teeth أيضا إذا كانت well separated roots راح تعطيني better stability than single rooted teeth or teeth with conjoined roots or fused roots. يعني هنا راح يكون عندي more bony support than the fused one. فإذا هسه قلنا shape, الفورم وأيضا length و adding to the number of the roots، كل هذه الفاكتورز تأثر على stability of the tooth و for this tooth to be selected for abutment for a fixed partial denture. Adding to that إذا كان عندي some curvature at the apical third of the root راح يكون also preferable if we compared to a tooth with a nearly perfect taper. Other factor that related to the root هو crown root ratio. طبعا هذه measured by using radiograph نحسب بيها crown root ratio اللي هي نقدر نسميها linear measurement of the length of the tooth closer to the crest of the alveolar bone to that embedded inside the bone. النقطة اللي نحسبها بيها هو crest of the alveolar ridge حتى نحصل على optimum crown root ratio لازم تكون نسبة الكراون إلى الروت 2 to 3. هذا بهالحالة راح يكون acceptable to be used as abutment for a fixed partial denture. شنو هو minimum acceptable ratio؟ minimum acceptable ratio to be 1 to 1 في حالة periodontal involved teeth. ومع ذلك أكو certain precautions to be used. شو وقت تكون indicated or to be considered إذا كان عندي opposing occlusion يكون mobile or periodontally involved or artificial teeth. في هذه الحالة راح يقلل من occlusal forces acting on the abutment teeth وبالنهاية راح نحصل less stress on the abutment teeth. فإذا crown root ratio لازم تكون 2 to 3. 1 to 1 accepted only if we have trouble in the opposing dentition. The third factors that to be evaluated is the factors that are related to the gingival periodontal complex. The abutment teeth must be free from periodontal diseases, periodontal pockets, gingival inflammation, وأيضا with adequate attached gingiva. هذه هي attached gingiva. الالفيولار bone أيضا لازم يكون healthy, good trabecular architecture with no sign of bone loss. وأيضا بالنهاية إذا كان good bone level we have no mobility. ليش؟ Since it will be carrying extra load. This picture is very close similar to the previous one that's showing the healthy versus unhealthy condition, the form and color of the healthy gingiva and texture, attached gingiva, level of the bone, bone trabeculae, كل هذه can be examined by using intraoral radiograph. In comparison to the other side, that's showing calculus, plaque, gingival inflammation, and bone loss. طبعا in such condition we cannot use this abutment for a fixed partial denture unless receiving a periodontal treatment and being healthy or almost healthy. Then we can decide to include such a tooth to the fixed bridge design. The other factor that is very important is the root surface area or the periodontal ligament area. The periodontal ligament area can be used as a scale or measurement to determine the potency of an abutment for fixed partial denture. The older statement by Tillman is that two abutments can carry or support two pontics, but then This statement revised by Johnston, which claimed another statement اللي هي very famous نسميها بالانتي سلو. الانتي سلو أو نسميه periodontal surface area أو perisegmental area هي معناها إنه root surface area of the abutment teeth اللي هي embedded in the bone it must be equal or greater than the root surface area of a teeth to be replaced. طبعا هذه تعتمد على certain numbers that have been measured to the root surface area of the abutment teeth واللي تحدد إنه number of replacement how many abutments needed to carry or support the missing area. فإذا كانت ال perisegmental area of the abutment teeth مثل ما نشوف بهذا الكيس greater than the perisegmental area of the teeth to be replaced فبالحالة يكون عندي ideal fixed bridge design. يعني نشوف هنا الميسنج هو 6 وأيضا 4 replacement راح by the second molar والsecond premolar والcanine فبالحالة عندي perisegmental area of the abutment greater than the teeth to be replaced فبالحالة يعتبر عندي more successful bridge. أما إذا كانت equal فأيضا also accepted يعني هنا عندي two missing supported by two abutment teeth أيضا according to Antis law and the certain numbers that I will show you later إنه can be equal to the missing area فبالحالة يكون أيضا acceptable bridge if other factors is optimum. Sometimes the periodontal surface area seems to be inadequate حتى لو كانت greater عندي مشكلة ب supporting tissue structure فبالحالة نحتاج إلى multiple abutments أو أحيانا يكون other abutment already needed a restoration فبالحالة we can include extra abutments. كل ما زيدنا abutments كل ما كان عندي more successful with good prognosis. Okay, وأيضا هذا يعتمد على other biomechanical factors اللي راح نشرحها إن شاء الله بالnext lecture. في حالة عندي one missing tooth like this case اللي هو lower 6 if it is replaced by two abutments راح يكون great generally very successful fixed bridge. ليش؟ لأنه perisegmental area of the abutment teeth هنا greater than the tooth the last tooth فبالحالة أعتبره successful. في بعض الحالات إذا كان عندي هنا ال first premolar already يحتاج إلى restoration أو أن يكون ال periodontal condition of the abutment not good enough فبالحالة ممكن إنه أضيف ال first premolar to the design حتى أحصل على more successful prognosis. أما في حالة عندي two missing teeth راح نشوف إنه ال perisegmental area of the abutment راح تكون equal to the lost teeth فبالحالة راح يكون عندي probably we can do the fixed bridge but the limit is being approached لازم إنه يكون عندي ال abutments in very health condition. أما third situation when we have a three missing posterior teeth like this case ال first molar with two premolars فبالحالة راح يكون عندي poor prognosis for the fixed bridge. هنا راح نسميه بال long span bridge. In two problems we will struggle with. Firstly, increasing the number of the abutment will increase the load on the nearby abutment وهذا تكلمنا به سابقا فإذا راح نأثر على healthy condition of the abutment teeth as well as for the bridge design we will have more flexing for the bridge فنأثر أيضا على the properties of the bridge as well. For that reason it will be unacceptable situation for the fixed partial denture. It means that risky as you can see. Till now there is a lot of dentists still continuously doing such long span bridges لكن هي تكون one of the main cause of failures. هنا هذا الجدول اللي ذكرته قبل شوية اللي هو developed by Johnston in 1963 reported an average measurements of the root surface areas that can be used to calculate the abutment to Pontic ratio. فهنا it is presented by numbers اللي هي ال root surface area هذا بالماكسيلري ارش، هذا بالمانديبولار ارش. هذا طبعا النمبرز مو للحفظ، لكن في نفس الوقت تساعدكم تعرفون النمبر اوف ريبليسمنت. اوكي، فهنا مثلا اذا كان عندي مست كاناين، نحسب البريسمنتال area of the nearby abutment لازم تكون greater or at least equal حتى نستخدمها. نخلي بالنا بأنه الكناين صار بالcorner of the mouth، وراح نتكلم عن ال problems of canine replacement. احتمال already we need an extra abutment in one or both sides. فبالحالة إنه إحنا اعتمدنا على البريسمنتال area measurement للتعويض، وأيضا اعتمدنا على ال other condition اللي هي location, for example for the location of the tooth، أو أحيانا ال healthy condition of the periodontium as well added to that, or if the abutments already need an extra restoration. اللي نخلي بالنا بأنه مثل ما قلت لكم هذا الجدول ليس للحفظ، لكن إنه سوون فد homework for yourself. replacing every tooth، لازم تعرف إنه في حالة missing central incisors how many, if it is suitable to use cantilever, or we can use one or two abutments. Every missing, you must know the number of the teeth that replaced those missing teeth. Thank you so much for your attention, and have a good luck.